My name is Kiera. I'm a software developer. I live in East York in Toronto. I am also a trans woman. So I've been part of the family practice for 10 years. Roughly 4 years ago, I went in to see my family doctor and talked about transitioning. And that's where I sort of started my journey with as far as medically transitioning and medically getting to my surgical step. So they helped with the documentation, the hormones, and getting me on track to get coverage with OHIP to get down to Montreal to have my surgery. One of my roles as a patient experience advisor is to share my story to allow the folks in the surgical program to develop their surgical program, avoiding any pitfalls or anything else that I experienced and taking advantage of the good things that I experienced as well. So throughout the process, I have seen some of the barriers. I've seen a lot of it around financial. For me, I'm a little bit older. I have financial means, but a lot of folks in the trans community do not have the financial means to take 2 months off of work. I came home after 8 days after my surgery. But it would have been much nicer to be able to spend my time close to home or even at home, where my friends and my family can help me, can look after me.
My name is Yona Krakowski. I'm a urologist at Women's College Hospital and the medical lead of the Transition-Related Surgery Program. In 2016, the province made steps to increasing access to transgender people have to getting both hormonal therapy and surgical referrals. And the big gap that exists right now is from when you have that approval to when you find a surgeon or a surgical program that can treat you. And we hope to fill in that much needed gap right now. There are great numbers that are available demonstrating what a significant need this is for care. If you can compare this to any other surgeries like an appendectomy or cancer surgery, it would be completely out of line to expect patients to travel for their surgeries. Until our establishment here, patients in the GTA and throughout Ontario had no local options for much of the surgeries that are required. And patients had to go either to Quebec, to Europe, or to America to get access to care. Our program is committed not just to the surgical services, but to the support that is required in leading up to the surgery and, of course, after the surgery. And Emery Potter and myself run a Thursday clinic where we see complications from patients that may have had surgery outside of the GTA and are now left with a medical or surgical issue without real access to a provider comfortable providing care.
I'm Emery Potter. I'm a nurse practitioner. I currently work at Women's College Hospital in the Transition-Related Surgery Program. The goal of this program is to increase access to surgery, and access can look like a lot of different things. One is just getting people to surgery. I think another thing about access is actually giving people the information to make clear, informed choices about surgery. And thirdly, I think it's about supporting people through their surgical journeys. Most trans people in Ontario actually live in Toronto, there are people obviously who don't live in Toronto, and we need to increase access to those people as well. But I think for the people who live in Toronto, we should be able to offer them surgical options here.
One of the big advantages of our program is that we have medical students and nursing students and surgical trainees that are with us. So not only are we providing care, but we hope to be training the next generation of providers in all different areas. The Transition-Related Surgery Program has demonstrated to me how many different people it takes to establish a program, how unique the contributions are from each person that's involved, and the significant progress that we can make as an institution when we're united in our goals and when we take feedback from the community of patients that we're trying to service.
Here at Women's College, we're building a program that really is accountable to the community and the people that we serve. And having them integrated into our program is so crucially important and valuable, and really elevates, I think, what we're going to be able to offer, and elevates the quality of our program. Already, the things that our patient advisor has added will help the access points for people as they navigate their way through surgery, I think will really make a big difference.
Trans visibility and trans inclusion within processes such as this are really important. It not only sends the message that there is an acceptance, that you are welcome here, and that we are willing to help you with your transition. It also means that you get a better perspective. Shortly after I went full-time, me and a friend of mine went down to a tattoo parlor. This is a butterfly in the trans colors. It's an indication of rebirth and where I've been and where I'm going.